I'm Paul Gordon, a STFM member since 1988. I think when I began in academic medicine, I'm a professor at the University of Arizona College of Medicine in Tucson. I have considered and wanted to ride my bicycle cross country since the bicentennial in 1976 when I first thought of it. I wasn't able to go that year, and it's always been on my to-do list. Last spring, my family and I were backpacking in the Grand Canyon in the backcountry, and I began talking about it again. I think the family was just a little tired of hearing about it, and they just said, well, just do it. Stop talking about it. And I said, yeah, just do it. So I said, okay, I'm going to ride my bike from DC to Seattle, across the country. And then, of course, what better way to do it than as a sabbatical, as in academic medicine, when you're tenured, you get paid. So I then needed to think, what topic could I do as my focus of research? I have lots of interest in healthcare policy, healthcare economics, the politics of healthcare. So the idea of investigating about the Affordable Care Act, or Obamacare, was really what pulled it together for me. So I put together a proposal, and as I was working on that proposal, things began to take more and more shape for me. And what I realized I really wanted to do was to just listen. There is ample survey data that tells us what our patients think about Obamacare. Those are generally snapshot types of things. They're yes, no, or various types of questions. But I wanted to have an opportunity to talk a little more in depth with people. So I created what I'm calling the Bike Listening Tour, which is on WordPress as well, so bikelisteningtour.wordpress.com if you are interested in following me. And what I've done is ride my bike, stop in a little town, engage in a conversation, and then just listen. The challenges so far, other than the physical ones of getting up hills with your panniers full, have been really the initiation of the conversation. I feel pretty confident in my ability to maintain a conversation, to not interrupt people, but initiating a conversation with a stranger has been a challenge for me. And as the days and weeks go on, it's getting that much easier. It's just fascinating, though, when people realize that you are actually interested in hearing what they have to say. So I've had the opportunity to stop, as I mentioned, these small towns, talk to people, and listen. I do not correct anyone. There are lots of ill-informed opinions about the Affordable Care Act, and I am not talking about any of that. I'm not correcting, I'm not teaching, I'm just listening. In my writing, I will have an opportunity to reflect in that, in commentaries and the like, and try to speculate where those ideas come from and what we as family physicians might be able to do to better inform our patients, because I indeed believe we have a responsibility to do that. There's no question that I believe the overwhelming majority of us avoid those discussions with our patients, fearful that we're talking about politics, and I do believe there's a fine line between politics, and I am by no means advocating talking about politics with our patients in the exam room. We're not going to be campaigning or lobbying for any particular politician, but I do believe we can help inform our patients. The Affordable Care Act and all of healthcare policy is an incredibly complex issue. The 10-second, 15-second soundbite is not a way to make an informed decision. So I do believe we have a role, and that's the role I want to play. Probably the most important end-of-trip goal is getting there. Most people that ride cross country try to take advantage of the westerlies, which means they travel from Seattle or the West Coast to the East Coast. My trip needed to begin in the end of April, when I was afraid that in the Cascades in Washington State there was going to be snow. So I needed to start on the East Coast. The end of the trip, going through Washington State and the Cascades, there might be some winds, as there will likely be across the whole state. But my goals, I guess, at the end of the trip, other than the actual physical component of finishing, will be a much more mature and developed understanding of what our patients think, how it is that they think, and perhaps this will inform me as both a clinician and, even more importantly, as a teacher with my students and residents, be able to help them understand what I believe our role to be in helping our patients make informed decisions, particularly as it comes to voting.